Hi, my name is Lakin, and we're here to do the physical assessment head to toe. We've shut the door for privacy, and I'm going to start by inspecting and palpating the scalp and hair. Is that okay with you?
Mm-hmm.
Okay. So we want to make sure that they don't have any lesions first. Feel around, see if they have any tenderness. Is any of that tender?
No, that's
okay.
good.
Okay, we're going to go ahead and palpate the thyroid. I'm going to come back here, and the trachea and cervical nodes. Do you feel any tenderness?
No.
And for the TMJ, can you open and close your jaw? Okay. And we're going to go ahead and observe range of motion. Can you go front to back and side to side? Okay. And then I'm going to inspect facial symmetry, so just look straight at me. Okay. Okay, we're going to do the Snellen chart for vision, and she's standing 20 feet away from this. Can you tell me what color this is?
Green.
And this?
Red.
Okay, I'm going to have you cover your right eye, and we'll start here on this line.
E, D, F, C, Z, P.
And this line?
F, E, L, O, P, Z, D.
And we'll do this line.
D, E, F, P, O, T, E, C.
Okay, and can you switch eyes?
E, D, F, C, Z, P.
And this one?
F, E, L, O, Z, L, O, P, Z, D.
Okay, and this one?
D, E, F, P, O, T, E, C.
Okay. Okay, and we're going to do the nearsighted test. She's going to hold the card at about an arm's length away and cover one eye and read this line for me.
937826.
Okay, and switch eyes.
937826.
Okay. Okay, and now we're going to check for the red light reflex. So we're going to look in both eyes. You just look forward for me, please. Okay, now check the other eye. Okay. Okay, now I'm going to check for the red light reflex in both eyes. I'm going to check the right first, just look forward. Okay, and now we're going to check the other side. Just keep looking forward. Okay, and I saw it. All right, we're going to check for peripheral vision. All right, I'm going to ask you to cover your right eye, and we'll check your left eye. Just tell me whenever you see my hand.
Okay. Okay. Okay.
And uncover that eye and switch to the other side. Tell me
Okay.
when.
Okay. Okay.
All right, we're going to check her eyes, her pupils for reactiveness. All right, just look at straight ahead. Okay. Okay, and now we're going to cover, we're going to see if both are reactive at the same time. And they are. Okay, now we're going to check your cardinal fields of vision, and I just want you to keep your head straight and follow this with your eyes. And now we're going to do accommodation. And I want you to look back behind me and now look at the card. Okay. And keep your eyes on the pen. Don't move your head. And this might make you a little bit cross-eyed. Okay. Okay, and now we're going to check her ears. And we're going to want to pull up and back for adults, and the cone of light should be at 5 on the right side, and it is. I'm going to check the left side. Do the same thing, but it should be at 7. And pull up and back. And it is. And now we're going to do the whisper test. I'm going to say it on one side, and she's going to repeat it back to me. Okay.
River, train, car.
And the other side.
River, train, car.
Okay. All right, now we're going to check her nose for patency. So can you just press on one side and breathe, and then do the same on the other side. Okay. Now we're going to check the olfactory nerve. She's going to close her eyes and hold one side of her nose closed and smell this and tell me what she smells.
Fruity.
And do the same thing with the other side.
Fruity.
Okay. Now we're going to check her sinuses. So I'm going to check below and above her eyes. Okay. And now we're going to check her oral cavity and should ask if they have any dental problems. Okay. Say ah. And do your tongue up, please. Okay. Okay, I'm going to listen to heart sounds now. I'm going to find the angle of Louis, and then we're going to go to the second intercostal space on the right, and that I'm going to listen to the aortic, and then over across to the second intercostal on the left is the pulmonic. Go down one intercostal space to the Erb's point, and then down to fourth for the tricuspid. And then we're gonna, if you can raise your arm for me, we're gonna listen to the fifth intercostal midclavicular space, and that is the mitral. Okay. Okay, now we're gonna listen to lung sounds. I'm gonna start up here. Just breathe normal for me, please. Listen to the lateral side. And on this side too. Okay. Okay, we're gonna listen to lung sounds on the back. Just breathe normal for me. And now I'm gonna put my hands here and check your diaphragm. Can you breathe deep for me? Okay. And now I'm gonna palpate kidneys. And you tell me if you have any tenderness.
No. No.
Okay. Okay, now we're gonna do teaching for self-breast exams. If you're of age to still have your period, then you would wait 4 to 7 days until after your period is over, and you would take the pads of 3 of your fingers, and usually you would lay down, and you can start in your axillary region and just go across your whole chest, ranging from light, medium to deep palpations. If you feel any lumps or any discharge, then you would talk to your doctor.
Okay.
Okay, and now we're going to inspect the abdomen, and you would just look for lesions or anything else. And then you want to listen first, and you start in one quadrant, and you listen for 1 minute. And you listen to all 4 quadrants for 1 minute apiece. And then you palpate lightly and ask, do you feel any tenderness?
Nope.
Just a light palpation, and then you would do a deeper. Okay, so if they would have any tenderness in any area, like if they had appendicitis in their right lower quadrant, you would check for rebound tenderness and you just do straight down, but you don't do it directly on top of where the pain is at. So I would do it right next and push straight down and right back up and ask them if it's tender. Okay, and now we're going to check for pulses. We're going to start at the carotid and we're going to listen with the bell side of your stethoscope. And we can palpate, but we don't want to palpate both of them at the same time. Okay, now we're going to go down to radial. And I'm going to go ahead and check for cap refill. And to your other hand. And cap refill on this side too. Then we're going to check for popliteal. And you push out on the knee and feel underneath on the back side. And if you couldn't feel this in real life, then you would check the femoral, but we're going to go here. And on the other side. And then on the inside of ankles, we're going to check the post-tibial. And on the tops of feet, we're going to look at dorsalis pedis. Okay. Okay, so now we're going to check for range of motion in an extremity. So we're going to use her arm. Can you pull it away from your body and back down, and then put your arm up and flip it over? Okay. Okay, now we're going to do the scoliosis screening. So if you could keep your feet together and touch your toes with your fingers. And we're just going to feel right next to the vertebrae and sure it's straight. And it is. Okay, now we're going to test your hand grips. So if you can just reach out and grab both of those at the same time. Okay, and then push up on my hands and push down on my hands. Okay, we're going to check cranial nerve 11 and do a shoulder shrug, so just go against me and do your face towards my hand and on the other side too. Okay, I'm going to go ahead and check cranial nerve 5 and just bite down, and we'll do 7 also. So close your eyes and we're going to, you tell me what your sensations are.
Soft. Soft. Sharp. Soft. Sharp. Soft. Sharp. Sharp.
Okay. And now I want you to keep your eyes closed, and I'm going to put a few items in your hands, and you tell me what they are.
Tape. Battery. A battery. Tape.
Okay. And now we're going to check for reflexes. We're going to start at biceps. So just hold your arm out. And do the other side. And we'll go ahead and do the triceps. And on this side. And now we're going to do patella. And Achilles. And now we're going to check, she's going to do her finger to nose with her eyes closed. So if you could close your eyes and touch your nose with one finger, and then do it again with the other hand. Okay. Okay, and now we're gonna do the heel to toe. Okay, and now we're also gonna do the Romberg test, and I'm just gonna have you stand with your eyes closed for 60 seconds, and you check if they sway, which she is doing.